your timer and here is your question. Right, so if you have read and understood, considering it communication skills station, kindly begin.
Hello, another Roshman. Hello, I'm Dr. Mo, one of the doctors working for Mr. Mann.
Yes, what do you want to ask to me?
Yes, well, I've been told by the nurse that you're waiting for your surgery to get done, but I have to give you some news. I'm really sorry, and I do apologize that your procedure has been postponed again. I'm really sorry about that because the surgeon who is going to operate has been called away for an emergency surgery.
Doctor, are you sure you are asking about my operation? You didn't ask my name. And yes, if it is my turn, why it is not my turn? It is nonsense.
Sorry, can I confirm your name, please, again?
But if it is actually me, then why I'm not on the list? It is not right. It is not right.
Yeah, you are Mr. Mike, and can I know your date of birth?
What are you saying?
You are Mr. Mike, is that right?
Yes, I am Mike.
Yeah, and your date of birth is?
My date of I'm 32 years old.
Okay, right. Yeah, it's correct. Sorry again. Your procedure has been postponed for today. I'm really sorry that you have been waiting for a very, very long time, and now you got the news that it is not going to happen today. Mr. Mike, since you have been waiting for a very long time, have you had any meal?
Just what do you mean by that? Do you think that it is not an emergency case? I have so much pain in my knee joint, and you are telling me that it is cancelled, and you know that it was cancelled previously twicely. So what is the matter with your hospital and with you?
I understand that that is really frustrating for you to be postponed again and again, but unfortunately there was an emergency that arrived and that arose, and so the doctor had to rush to the emergency operation. It doesn't mean that we are not taking care of your case, but we put you in today's operation list, but this emergency things happened, so we couldn't help. I'm really sorry again.
If you're really interested to operate me, you should call to him and ask him when he will like to operate me. Please call him.
I understand that you really want to get this procedure done, but at the moment the surgeon surgeon taking care of you is already in the theater operating as somebody else. So I think it isn't a good idea to call him during operation, but I will try to reach to him once he is out of that operation, and I can arrange to meet him to have an appointment after a few hours once he is out of the operation.
I believe it is a neglected behavior for the patient. I want to consult another doctor. Is it possible at present?
Mr. Mike, we're not trying to neglect you. To be honest, we are always trying our best to help with your case. But I'm really please accept my apologies. This happened. But yeah, for the changing the surgeon, yeah, it is your choice. But for to be honest, it would be a good idea to switch to another surgeon at this point, because that new doctor will have to go through your notes again, and it will be very difficult for him to deal with this, and it would take very long time. So so I think it is not a good idea, Mr. Mike.
Doctor, as I know that you are working with your consultant, can you do this operation to relieve my problem?
Oh, Mr. Mike, I wish I could, but it is beyond my capabilities, and I can't do any procedure without any supervision. So I'm really sorry. Yeah, all we have to do is to put you into another slot, or as the nearest slot, and wait for it. I'm really sorry.
Please give me another appointment. You disappoint me very much.
Yes, I cannot give you the exact date and time at the moment, but once we know your schedule, we're trying to reach to you either via a message or a call as soon as it is out. This time we're trying to prioritize you, mentioning that you have been postponed twice, 3 times this time, and so we're trying to put you at the front, at the very first place.
Okay, promise me you will not postpone me again.
Mr. Mike, but I think that I cannot guarantee that kind of promise, because if something really urgent and very emergency case happened, I think it will have to prioritize the emergency case. So because it is the hospital protocol and for the patient safety, it doesn't mean that we are neglecting you, but some things are like sometimes get out of control, and we have to prioritize patient safety. Yeah.
But how can I work now? How can I can go on my job?
May I know what job is that? Does it involve a lot of weightlifting and moving?
Yes, yes. I am an electrician. I have to work on foot.
I'm so sorry to hear that, Mr. Mike. In that case, I can write a medical certificate to your employer mentioning that you are not you need to get a leave because you cannot do that kind of physical activities, and you need some more time to get a rest until your procedure. Then, how does it sound for you?
Can I walk on my legs again?
Yes, you can walk, but there will be a bit of wear and tear when you walk. However, it doesn't mean that you have to lie in your bed 24/7, 24 hours and 7 days a week. You try to avoid weight bearing exercises and very strenuous exercises, so that will avoid wear and tear to your knee. And I would suggest you to do non-weight bearing exercises such as swimming, and I can also liaise you with a physiotherapist who can give you advice on good exercises that is appropriate for you. Are you with me so far, Mr. Mike?
Doctor, I take painkillers, but nowadays I feel heartburn. Can you prescribe another medication?
Oh, I'm so sorry to hear about your stomach problem. How long have you been having this?
For the last 3 weeks.
Oh, I see. So at this point, I can switch to another painkiller, which doesn't have any side effect to your stomach, to your tummy. So if you doesn't get better with this medicine, I can arrange esophageal gastroduodenoscopy, which is a test, like a camera test, which we can see if there's any ulcer or some problem.
No, Dr. Cynthia, you'll not do that.
Okay, yeah, I can arrange.
You'll
something.
tell the patient to stop using diclofenac, which patient is using, and you'll add another medication and antacid.
Stop this drug and arrange another drug.
Okay, thank you, doctor.
No, patient will say patient would still want to complain. And you'll tell about the pulse to the patient and you'll apologize.
About which one?
Pulse, patient, LIC.
Pulse, yeah. It's a patient complaint, yeah. So if you still want to make a complaint, there's a service called patient advice leadership service. You can write a letter to them and mention your complaints.
Okay, doctor, I do not need to apply patient action liaison committee.
Patient will do that. Patient in this scenario, in this patient. So, okay, thank you.